Good afternoon. You're watching from Faraja Diagnostic and Medical Center. Yeah, those who are new to our facility, we are located on 49 Matawa Street, Livala Stage 4B. We used to be, and we are called Faraja Diagnostic and Medical Center. So our services actually have increased. Our location, we're on 49 Matawa Street, Livala Stage 4B. We used to be behind Kawata Clinic when we opened in 2011. And our core business that time was just diagnostic ultrasound. We actually concentrated more on pregnancy, pelvic ultrasound, echo, and ECGs. But we have diversified and we have added more services. And we have upgraded our clinic to Class C, which means we have an outpatient service as well. We have an antenatal clinic, which runs every day. Our operation hours are from 8:30 to 19 hours. Weekends, we operate the same timings from 8:30 to 19 hours. Now, today, I think the first topic that we need to discuss just briefly is about the importance of doing a pregnancy ultrasound. We are aware that most of the time when pregnant women seek their first visits to a health facility, they will be requested to do an early pregnancy assessment ultrasound. Now, pregnancy ultrasound is very important because one, it will determine the location of the pregnancy. Two, it will actually determine the number of the fetuses or babies. Number three, it will actually give us an accurate gestational age. So that is how old the pregnancy is. Not only that, there are other factors that we look. We look at viability. Is the fetus viable? Is there a fetal heart at that stage of pregnancy when the fetal pore forms, like after 6 weeks? We also look at the fluid. We are going to look at the fluid, the amniotic fluid that is in the pregnant sac. We also look at the other things that we find in the uterus, like maybe is the pregnancy coexisting with maybe fibroids or ovarian cysts. So those are the primary things that we look at so that we can advise. If we find a problem, we advise the mother that during her pregnancy, she's expecting that she will require more visits to the gynecologist so that she can be followed up properly. And also, the follow-up scans are also important for fetal growth. We need to see a progression of growth from the conception, from say 6 weeks to 11 weeks. At 11 weeks, we actually also check for the signs of Down syndrome. Then after that, at 20 weeks, we do what we call an anomaly scan. Anomaly scan is a scan that looks at the structure of the fetus. We look at the head, we look at the spine, we look at the heart itself. Is the heart well formed? Are the four chambers visible? We look at the abdomen. Is the abdominal wall intact? Because there are some babies who are born with defects in the abdomen. So we also look at, for example, in the head as well, we look at fluid in the ventricles. Some babies who have fluid in the head. So all that has to be identified. We look at the whole spine. To rule out things like spina bifida. We also go to the limbs. We look at the arms, the upper limbs, the lower limbs. Are they all formed? At 20 weeks, we're able to do the anomaly scan. So the 20-week scan is also very important. Apart from that, those who would want to know the gender of the baby, really, we will be told. And usually we don't just tell anyhow, unless it is requested. And by the way, the gender scan is not like 100% the time that we see. Sometimes the baby might not lie in the proper position. That's why I would ask you to come back yeah, for a rescan so that we can confirm. Once we see the organs that differentiate a male and a female, we'll be able to confidently tell you. So now, this doesn't require a 3D ultrasound. It just requires a two-dimensional ultrasound in good hands with someone who is well skilled to image the pregnancy. We also look at the codes. The code, has it got the 3 vessels that we usually see? So that is what we look at 20 weeks. We also look at the amniotic fluid, the placenta position, very important. Placenta should not lie in the lower segment of the uterus. So all those are assessed when we are doing ultrasound. It looks a little bit easier, or maybe sometimes within 20 minutes we are done, but within that time we've actually checked quite a lot of things to do with your pregnancy. So we advise that now it's up to the physician that is looking after you whether they are going to request more serious scans depending on your condition. But usually if the pregnancy is progressing well, they'll ask maybe 3 to 4 scans before you deliver. Now, there is also what we call the third trimester ultrasound. That is the ultrasound that we do in the third trimester, in the last 3 months of pregnancy. Mainly, it's for presentation. How is your baby lying? What is the position of the baby? What is the amount of fluid? What is the weight? Is the weight corresponding, correlating with the weeks? So that is the third trimester ultrasound, which is a must. So ultrasound is not harmful. So we encourage that all of our pregnant women should actually be given an opportunity to attend an ultrasound session. So in the third trimester, we look at also the placenta. The placenta is graded from grade 1 to grade 3. That is maturity. So there are certain things that we see on placenta that tells us that this baby is actually mature, because we look at the placenta, usually it's calcified, it does calcifications that show that it's a grade 3 placenta. And also in the third trimester, maybe we are talking about a few weeks before delivery, there's what we call biophysical profile. So the biophysical profile will give us the status, the fetal well-being of the baby before it is born. And here what we look at the fetal movement, we look at the fetal cardiac activity, that is the fetal heart, and we look at the amniotic fluid. We also look at the fetal tone. The baby should have a good tone to show that it's in good health. So we also look at the level of the amniotic fluid. So those are the parameters that we score, and usually we score up to the number 10. So if we say 10 out of 10, so that means your fetus has scored 10 out of 10. So chances of a risk during pregnancy are reduced. So we know that this baby, wow, during antenatal is scored so much. When we did the biophysical profile, the score was 10, so it's not really likely that we expect a very successful delivery. Now, if the physician, the doctors, as they are doing antenatal, they notice that maybe the heart rate is slow, the mother has also noticed that the fetal movements have reduced, so they request again to us to perform pregnancy ultrasound to do what we call biophysical profile. So they would want us to score now this baby, although this baby we haven't been following, but they would want to have a score to see whether there is any risk of asphyxia or poor oxygen going to the baby for one reason or another. Maybe the cord is around the neck, or maybe the cord has got a knot, or maybe there's something else. So they would want us, maybe there's a detachment from the placenta. So they would want to have a score, what we call the biophysical profile. So in short, for today, that is briefly what we wanted to highlight you from Faraja Diagnostic and Medical Center. So we just felt that we should be engaging with our clients, and so that we update you how we've added other services. On our page, we have a WhatsApp line. If you don't get us on our message, on our messenger, please, you are free to chat with us on WhatsApp. We hope to see you during this same week. We'll be actually chatting more topics apart from pregnancy related things. We'll go to cardiac problems, the need for us to assess or evaluate our hearts without waiting for a problem to occur. So thank you very much for watching and for listening, and we thank you for your wavering confidence and support in our services. We can't be 100%, but in any facility, there's always chance for improvement. So it is you that we rely on to be there and share the information to those that probably they would say maybe ultrasound is harmful. There's no radiation. There's no ionizing radiation in ultrasound. It's very safe. There's been no known human effects, bio-effects on the fetus or the mother. So you have a good evening and have a wonderful 2024.